Evening everyone, Pete from Active Health here. We've moved on to K in our A to Z of chiropractic, and K is for knee. So the knee is a complicated hinge joint is the best way to describe it. It's not like your elbow, where it's just literally a backwards and forwards joint. Your knee has to be able to glide, twist and turn as well as bend. So it's quite a complex joint, although a lot of people think it's a lot more simple than that. The main injuries we see are traumatic injuries to the ligaments and cartilage, or what we call meniscus. So that can be down to a twist, a bump, a fall, or any sort of sporting injury. We also see patients with osteoarthritis, so some wear and tear in the knee joints themselves. But something that's very common is patellar maltracking. So the kneecap will not track properly in its groove. It can be called patellofemoral pain syndrome, or as I say, patellar maltracking. That's characterised by a pain in the kneecap area, normally worse with walking upstairs and when you really drive and load through the knee. I'm going to show you a little exercise at the end of the video, a good way of controlling that. With the osteoarthritis, that's more of a general knee pain. That can be one side or the other, usually diagnosed with x-rays, but something we can help along with as well, as long as it's not too bad. If it's very severe, then we might have to talk about knee replacements and things, but we can normally combat that and sort of keep that away. With the more traumatic ones, the ligament and the cartilage, the meniscus injuries, initially ice and anti-inflammatories is a really good thing to do. And then we can get on and treat those ligament and cartilage injuries. We use various techniques to loosen everything off, get it all working better, and get that pain settled down. So the knee, a complex, simple hinge joint, simple way of describing it, and something we can treat and help you with a lot of the time. Chris will be with you tomorrow or the next day for L, and then I'll be back for M. So we'll see you for next time. Here's the exercise. So the kneecap pain, the patellar maltracking is caused around the kneecap itself. What usually happens is this muscle on the inside of the knee becomes quite weak. That means the kneecap gets pulled across into a wrong position as it moves, and it can click and catch and cause you some issues. So what we want to do is strengthen the inside of the knee. There's a couple of ways of doing it, but a really, really simple one is you need a rolled up towel, quite thick. Normally you can do this lying down, but I do it sitting up. And what you're going to do is you're going to take your foot, you're going to turn it up and away from yourself, so from my left leg up to the left corner of the room, and then from that position I'm just going to straighten the leg. So I'm trying to lock this part of the knee in and then back down. So we're working in this part of the knee here, get that stronger. That's the part of the knee that pulls the kneecap back in line. So then when we come to move it up and down, the knee tracks nice and true, and then you don't get these clicky, sharp, nasty pains. Really, really good exercise to try if you have got those sorts of knee problems. To give them a go, and then we look forward to seeing you soon.